following portion of My Carolina is sponsored by...
One of the most common misconceptions around dentistry is the concept, the procedure of sedation. I'm here with Dr. Christy Bryant at Tryon Family Dentistry to learn a little bit more, kind of put an end to these misconceptions that we're hearing about when it comes to sedation. So can you give me a brief overview of what that term actually means?
Yeah, absolutely. Just to start with, so many people hear sedation and especially dental office.
Right.
And there's so many just kind of like, there's horror stories in the media, that kind of thing, that have really made people kind of confused on the subject and also scared. So sedation, as the term of how we use it here at this office, we offer IV moderate sedation. What that is you still breathe on your own.
Right.
It's IV medication delivered via a vein. So to basically put you in a restful spot where you're still able to respond purposefully to commands.
Okay.
And that's the definition of moderate sedation. And that's pretty much where you're asleep during the procedure, you're comfortable, you don't remember it afterwards.
Right.
But if we need you to cooperate during the procedure with us, where I say, hey, I need you to turn a little bit to the left, a little bit to the right, you're able to do so because you're in a state of consciousness where you're not completely out, like a wake hospital, that kind of thing.
Okay.
I think that's where a lot of people get the misconception with it from, because they hear all these horror stories about sedation in the dentist office, and they're thinking like an ER scenario, that kind of thing.
Right.
So,
and there are different kinds of sedation?
there are. At this office specifically, we offer IV moderate sedation, which is what I just told you about.
Right.
We have a nurse anesthetist that does all of our sedation for us. We always, top of the line safety as far as that goes. Our nurse anesthetist is absolutely outstanding. She monitors the whole time. She delivers the drugs, so that way that us, the dentist, can focus on you and the actual procedure. So we offer that here, along with nitrous oxide, laughing gas. Many people have had that. Some other offices offer oral sedation, which is just kind of, you've probably heard it, where you take like an anti-anxiety medication an hour before.
Okay.
We do that in certain senios, but those are pretty much the main three that we offer. And then, of course, for any procedure, you're numb. You get local anesthetic. People think that, like, am I going to have local? I'm like, yes, we don't torture people here. So you'll have that regard. That's the baseline. You're going to get that no matter what.
Gotcha.
But,
okay. Well, who would be a good candidate for this? What kind of procedures do you use sedation for?
So we do everything. A lot of people, the issue is they think that, like, dental anxiety, everybody has it. I get it. We're not going to judge you. Everybody's got that problem. It's fine. So a lot of people think that they can't be sedated for the most routine things. They think, oh, for sedation, it needs to be I'm having implants or I'm having a root canal, that kind of thing. We have people that we sedate for cleanings and exams. You can literally be sedated for anything here. We're not, there's no like, oh, that's dumb. We're not going to do that for you. We're here for you. We want you to be comfortable.
Really good to know. I'm an anxious dentist girl. So
oh, girl, everyone is.
I'm glad to hear about that.
I try my best to fix that, but I get it. It's ingrained.
Well, you know, again, this goes along with those misconceptions. Is it safe? People are curious about the safety risks.
That's the number one thing, and that's what, when people ask about it, that's what they worry about. A lot of the stories you hear about, like, crazy things that have happened in dental offices along with sedation, a lot of the times it's pediatric. Sedating kids is a completely different ballpark, and we focus adults, that kind of thing. So a lot of that right there is a lot of the things that scare people. Again, though, there's so much that goes along with that. I don't want people to misconstrue the two. It's sedation that we do is safe. And especially because we go the extra mile, we only have nurse anesthetists administering our sedation. We have two that we work with really closely, so they're aware of us, they're aware of our patients. They go through medical histories absolutely in depth. The protocols we follow, both pre, during, and post-sedation, are to a T. It's pretty much just, we do absolutely everything according to safety guidelines and research and best practices, and for that reason, there's not really much for people to worry about at all.
So if there are people out there who may have a few questions, or they have these concerns still and they need to alleviate them, you guys can help that process. So where can we go for more information?
So TryonFamilyDentistry.com. Absolutely. Go check us out there for any information, and then you're off it. I mean, you can call us anytime. We have people do that a lot. You can talk to me, talk to our nurse dentist, talk to anybody you want to.
Perfect.
So help you out.
Awesome. Well, we appreciate you being here and helping ease a little concern today. Thank you.
For sure. The preceding was sponsored by